Hi once again, everybody, and welcome to the Health Channel. All health, all the time. I'm Ed Berliner. Welcome to the Baptist Health South Florida studios. Thank you for joining us. Vaccinations are important. They can be used to prevent seasonal illnesses like the flu and a lot more. They can also be used to prevent life-threatening illnesses like cancer. And prevention starts early. This time around, we're going to talk about vaccinations for children and the debate to vaccinate or not to vaccinate. Joining us to talk about these vaccination controversies is Dr. Mario Zambrano, a pediatric emergency medicine physician at Homestead Hospital. Doctor, it's a pleasure to see you again.
Thank you, Ed. It's a pleasure being here.
We have a lot to talk about here.
Yes, we do.
Let's get right to vaccines. Let's start from the beginning here and sort of set the stage. How long have they been around and how were they invented?
Well, vaccines have been around since the 10th century. You know, there's history back from then of people inoculating with agents in the hope of curing disease. When Jenner in Britain and Louis Pasteur in the U.S., in France, did more research, they found ways to make it safer. Because the truth is, inoculation and vaccinations are different.
Okay, stop. I'm going to stop you there.
Right.
Tell us then the difference between inoculations and vaccinations.
Well, inoculation, back in the day, they used to take pus or agents from the scab and inject that into a patient in the hopes of preparing the body to fight the infection. Nowadays, we have purified antigen that's safer. It's not, doesn't cause as much reaction and doesn't cause disease. Back in the day, the inoculations would make you sick, and then some people would even die from the inoculation. But you know, it's done more good in the sense that we learned about how to prepare these agents so they don't kill you or cause too much harm.
So how then do the vaccinations work in preparing the system against infection and against disease?
Right. And that's a good question. When we're born, our immune system is very immature and does not know how to handle a lot of diseases and conditions. So everything to the body is an allergen. Vaccines, food, viruses, bacteria. So the only way of our body fighting it is creating a memory of these conditions. So when you're born, your body is very naive to a lot of these agents. So we learn by suffering these conditions, but we can't do that with everything. You know, some of these diseases are deadly, as we all know, like tetanus and polio and pertussis and all these conditions are preventable by giving the vaccine and preparing the immune system to fight them.
Let's put that in a different phrase. When you have children, your kid's immune system is naive, knows absolutely nothing about the world that it's been born into. And if you are not preparing it for the world that is here right now with the different diseases, the different airborne diseases, the different conditions, then the child's body does not know what it's dealing with, has no way to fend it off.
That's correct. And maybe you're lucky and your immune system is strong, or the agent that you are exposed to is not very strong, or is not a virulent strain of the infection, and you may survive it, but you may end up with some sort of side effect from the disease.
Are they all? They're not all made the same way, right?
That's correct. Some are live attenuated agents, like measles, mumps, and rubella, and varicella. Some are the protein derivative of the disease, and the immune system is stimulated in that fashion. It's well known that live vaccines, like the flu vaccine, the nasal one, and MMR and varicella, they stimulate the immune system a lot better. So it creates a longer protection for that matter. So we don't have to vaccinate as much. The flu vaccine, on the other hand, you have to vaccinate every year because we don't remember. Our immune system does not remember.
All right, let's hit the tough stuff now, because we've talked about this off the air, and this is something that I have talked about in many interviews over the years. Why are there so many myths about vaccines, and how did all this opposition get started?
Right. Well, one of the reasons why I like to do this show is because I'm passionate about vaccines. Unfortunately, there's more advertisement on cholesterol than there is on vaccines, and it's topics like this or shows like this that brings these topics back into light. A lot of people don't remember about people dying of tetanus or pertussis or measles, mumps, and rubella, but they do remember, of my grandparents having high cholesterol.
Is that just it? We've reached a point in society where many of the dangerous diseases we have managed to either eradicate or place under control because of vaccinations, and because it's simply not in our face every single day and in the face of mothers and fathers everywhere. They think it's magically gone, right, and yes, all cured and all wonderful. Yeah.
This conspiracy theorists think that because these illnesses are not made, they're not glamorized. We're not needing these vaccines. But smallpox, even though we don't see it anymore, there is something called warfare that can bring those agents back, and that's why they inoculate soldiers and people that are in the CDC, for example, exposed to these viruses and bacteria.
Let's put some numbers to work here so that people can understand this. According to the CDC, the Center for Disease Control, vaccinations continue to save lives and hospitalizations. Take, for example, the chickenpox vaccine. It now saves approximately 50 child deaths and thousands of hospitalizations every single year. The CDC says vaccines are vital, especially for children.
The ability to vaccinate against disease is heralded as one of the greatest medical advances of modern civilization.
Hand washing before surgery and clean water supply, it really ranks right up there.
Dr. Robert Jacobson is medical director of Mayo Clinic's Community Health Immunization Program. He says we may be surprised to learn getting vaccinated is largely voluntary.
There are, for civilians, no federal or national requirements for vaccination. When you hear about mandates or requirements, you're actually referring to school, daycare, and college rules.
In the U.S., a group of scientists and physicians called the Advisory Committee on Immunization Practices recommends which vaccines will do us the most good, from infancy through old age.
Now, what's on that list? We have measles, mumps, and rubella, of course, diphtheria, tetanus, and pertussis, flu vaccine, pneumococcal conjugate vaccine, the meningococcal vaccines. We have hepatitis A, hepatitis B.
Dr. Jacobson says while studies have proven there is no link between autism and vaccines, some parents still have concerns.
And that question mark that has been raised has been harmful enough to cause some families to choose not to get vaccinated and have left their children and, frankly, members of their community at risk for measles.
Lax attitudes about getting vaccinated allowed a measles epidemic to explode in France, with 14,000 cases in the first 6 months of this year.
Frankly, across Europe, 33 countries are now suffering outbreaks of measles.
And finally, adults need to stay up to date as well. Only 40% get their recommended flu shot. Chickenpox and mumps can have devastating consequences, and
every adult should have by now received a dose of diphtheria, tetanus, acellular pertussis.
Yet Dr. Jacobson says only 6% of adults have received that shot. For Medical Edge, I'm Dennis Stoda.
We are going to make a point that was made in that story,
right,
and we're going to make it very emphatically here at this point. There is no proven link between vaccines and autism. The studies have been done over and over again, and there is no link. Doctor, I'm not a doctor. I play one on TV sometimes. You're the doctor. Did I say anything wrong just now?
No, you did not. Unfortunately, back a few years ago, there was a study published that was proven to be false, and that study that was published in a reputable magazine was believed, even by physicians. So that study was one of the biggest medical hoaxes in history. and has done a lot of damage to vaccinations and people that want to get vaccinated.
We're going to dig more into autism later on, but I just wanted to make that, I don't think you can say that out loud enough so that people can understand. The thing that always has caught me is you've got vaccines required for schools and some workplaces, but there are no laws requiring them. If they are so important, then why don't we have laws requiring vaccines?
That's a good question. You know, I think it becomes boils down to the ability to choose, you know, your health in America. I mean, some people will research it and say, okay, I'm okay with getting vaccines. But a lot of us, you know, now with the advent of the internet and social media, you know, we're reading a little more about problems that vaccines have brought supposedly to people. So, and some people believe that. Now, I wish some vaccines were mandatory, but unfortunately, we live in a society we can't force people to believe what you believe. There are ways around, like to go to school, you have to get some vaccines, but some people go around it by getting a what we call an exemption, which it could be religious or it can be, you know, for whatever reason.
Vaccines for kids, how are they different from the vaccines for adults?
Well, there's a few differences. One is the concentration of the antigen. So hepatitis B, for example, has less of the agent protein versus the adult. The adult has a little more memory of these diseases, so they have to be stimulated a little more than the child.
Okay, and they're more important. I mean, let's make sure we say that. Children's vaccines versus adult vaccines, yes, you need them, but the children's vaccines are much more important.
Definitely. You know, children are more in a setting like in school where there's multiple children. So these vaccines are protecting our children also by something called herd immunity. So the majority of children or individuals are vaccinated. They protect even the undervaccinated or the unvaccinated individuals.
Something else we will talk about also as well as we go through this show. Coming up, autism and vaccines, as we alluded to. Is it worth the risk? We will talk to Dr. Mario Zambrano about recent studies that shed some light on this issue. It is important that you listen and take it all in. You're watching the Health Channel, all health all the time on South Florida PBS. If you have a question for the doctor, 855-796-4475, 855-796-4475. Go to the website, allhealthtv.com, and you can learn more about what we do here. Valuable information still to come. Stay with us.
Dear humans, I stand here today not for myself, but for every tail wagger, sloppy kisser, and curtain ninja. I stand here for each one of the nearly 4,100 dogs and cats killed in shelters each day, asking you to join our cause and help us make sure every best friend has a chance to meet one of their own. With Best Friends Animal Society leading the charge and your help, we can save them all.
Have you mixed your pain meds, your sleep meds, your allergy meds? Call the Poison Helpline. Has your child swallowed household cleaner, a chip of paint, a wild mushroom? Call the Poison Helpline. Have you been bitten by a spider, a snake, an insect? Call the Poison Helpline. Poisonings can happen at the home, on the job, or in the great outdoors. Call the Poison Helpline first to speak with medical professionals who can give you free personal advice anytime. Save the number, save a life.
C stands for courage, collaboration, compassion, and cutting edge. With the most advanced radiation treatments, including proton therapy. At Miami Cancer Institute, C also stands for cure. World-class cancer care right here at home. Learn more at miamicancerinstitute.com.
And welcome back to the Health Channel. We are indeed all health all the time. I'm Ed Berliner. Thanks for being here. With us is Dr. Mario Zambrano, a pediatric emergency medicine physician at Homestead Hospital. If you have a question for the doctor, use our toll-free number, 855-796-4475. This is your chance to talk about vaccinations, autism, diseases, what we're talking about here today. Let's talk risks now, some of the side effects to vaccines. If you are thinking right now, there's many areas that we can go here, but the 2 or 3 off the top of your head that really are important to know.
About side effects, you mean,
side
right?
effects to the vaccines.
Basically local reaction, because when you're vaccinated or have been vaccinated in the past, you're going to have some memory of the agent that we're inoculating. So your immune system will react to it, and you may have a local knot, a little bit of pain, some fever, but it's usually short-lived. Very seldom you see a person develop an allergic reaction to one of the agents, a protein, so you'll have a little more of a reaction. Some children will have febrile seizure when you're young. You know, children under the age of 5 or 6 can have a febrile seizure when the fever goes up too high. But it's not the fever that causes the seizure, it's how fast it goes up or down. So it's important to remind parents, you know, that the vaccine didn't cause the seizure. And it was the subtleness, you know, the acuteness of the fever.
But that's an important point to make.
Correct.
It is not the vaccine, that caused the risk factor, that caused the issue.
That's correct.
Which we can't say enough. It's not the vaccine. Okay. I want to get to this because we've talked about vaccines a little bit, and let's dig in a little deeper. Let's take a look at how vaccines work. We mentioned it earlier, but let's understand a little bit more of how they are important, and looking at the flu specifically, a vaccine that is recommended for both kids and adults. All good ideas, and now we have a few more good ideas when it comes down to vaccines, because it was once believed that an MMR vaccine was linked to autism. Dr. Zambrano, is this true in any facet?
No, this was debunked with many studies, and now it's well known that vaccines are not the cause of autism or any neurologic disorder. Having said that, you know, there are certain patients that can react to the vaccine because they have a fever, they have an allergic reaction. So that may be deemed, you know, a problem. But that it's linked to autism is false, and I don't think any physician or pediatrician that knew that a vaccine can cause this type of harm would give it to their children or to their patients.
We've talked a lot about the vaccines here, but let's drill down a little bit. Are there any other vaccines that are raising a lot of questions about their, not just their efficacy, but what they may be doing in regard to risks?
Yes, definitely. There's a few myths. For example, hepatitis B has been linked to MS, multiple sclerosis, and also The HPV vaccine has been linked to infertility. So there's a few misconceptions out there. You know, if you find one person that does not agree with it or says that this is what happened, they'll believe it. You know, some people believe it.
Is it not fair to say, though, that we live in an information age that is unparalleled in the history of modern mankind? You can find, in seconds, you can find the answers to just about anything by going to the internet. However, the internet is chock full of falsehoods. It is chock full of rumors. But at least if you do some research and go to reputable places, reputable sites, if you will,
right,
you can find the truth. You have to do the homework and
correct,
filter through the nonsense.
That is correct. And brings me to another point. You know, you shouldn't listen to your neighbor or to the pharmacist or the chiropractor about vaccines. Listen to your physician. If you trust your physician, go to reputable websites like the CDC.org, which has the latest and the greatest information on vaccines or diseases.
And there are reviewed publications out there. There are medical publications
correct,
out there. But the CDC is still the best place to start. It's
that's
easy,
correct,
and it also speaks to the general public.
Correct. That's a good point, because if you go to the Lancet or the American Journal of Pediatrics or the British Journal, you know, there are articles that are designed for professionals that know how to read these articles, and to a layperson it may be Chinese.
Trust your doctor.
Correct.
Your doctors
Trust
have
your
been doing
physician
this for their lives. Trust your doctor. So let's go ahead and consider the risk of not vaccinating your child. I want you to look at this now. Just last year, a community suffered when parents chose not to vaccinate their children, causing a measles outbreak in Minnesota.
It's a virus that has ravaged the state of Minnesota for the better part of the last 2 months. With over 70 cases statewide, the measles outbreak has been deemed the largest outbreak in Minnesota in the last 30 years. The largest concentration of cases is in the Cedar Riverside neighborhood of Minneapolis, which is a predominantly Somali American population, where there has been an ongoing debate for years about the effectiveness of the measles, mumps, and rubella, or MMR, vaccine. Many reports say that as many as 42% of Somali American children were unvaccinated prior to the beginning of the recent measles outbreak. I talked to Dr. Steve Vincent, Chief Medical Officer of the People's Center, located in the heart of Cedar Riverside, and asked him why so many Somali children were unvaccinated before the outbreak.
Well, it was fear of autism that could be caused by the MMR vaccine. It's an unfounded fear. It's based on a study from England nearly 20 years ago in the 1990s by Dr. Wakefield that was later found to be falsified.
Leo Cashman of the Minnesota Natural Health Coalition, an anti-vaccination advocacy group, states that the MMR vaccine still causes autism.
There have been findings of the vaccine type of measles virus in the intestines of children with autism. And this is what has been found in Minnesota in the Somali community. They find that there is an onset of some kind of vaccine injury. It might be autism, it might be encephalitis. The child loses the normal ability to speak. The Somali community has noticed this and has observed it and talked about it and gotten more information about it.
Now, after hearing the claim that the measles, mumps, and rubella vaccine causes autism, I came here to downtown St. Paul and visited with Chris Erisman of the Minnesota Department of Health and asked her if there was any merit to that claim.
There have been a number of studies, so multiple studies by different researchers using different methodologies and performed in different places that have all refuted a link between vaccines and autism. And so that to me is what's really, important, is what did the science show?
And for Erisman, a mother of two, the vaccination debate is personal and hits home for her like it does for many parents across Minnesota.
The reason that I can say with confidence that I believe in vaccines is the two most important people in my life are my children, and they are fully vaccinated. And if I had any concerns about the value of vaccines, I wouldn't have vaccinated my own children.
In the end, the light at the end of the tunnel could be near for the measles outbreak, as the rate of confirmed cases has slowed down drastically in the past 2 weeks. However, signs are pointing to a much longer vaccination debate, which will outlive the 2017 Minnesota measles outbreak.
Two things very quickly with regard to that child who had was suffering from measles and autism. There is no proof, correct me if I'm wrong, there's no proof that it caused the autism whatsoever. And the second part of this is what you considered earlier the herd mentality, where what happens is if you don't get your child vaccinated, you put every other child at risk that is in a school or a town area.
That's
yes?
correct. Yeah. Not being vaccinated, the more children are unvaccinated, that ability to protect yourself using the herd immunity decreases.
Herd immunity, I wanted to get it right. But still what you're doing is you're putting everybody at risk.
That's correct.
Not just your child. All right, coming up, the latest vaccines for your child and the information you need to get them, and you should get them. That is the important thing to consider here, because that's why we're here today, to dispel a lot of these rumors and myths. You're watching the Health Channel, all health all the time on South Florida PBS. If you have a specific question for Dr. Zambrano, please call in. The toll-free is 855-796-4475. Don't forget the website, allhealthtv.com. Much more coming up as we give you the facts right here on the Health Channel.
Everyone deserves a decent place to live.
Everyone.
When a future homeowner partners with Habitat for Humanity to build or improve a home, they build a better future for themselves and their families.
For my family.
For my family.
For my family.
With a little help, we all have the potential to stand on our own.
Potential.
Visit Habitat.org to provide help to families like these today.
In the past 50 years, we've made a lot of progress in smoking prevention. But if we don't do more, 1 out of every 13 children alive today will die early from smoking. That's 5.6 million precious lives we can save. Together, we can make the next generation tobacco-free.
At Miami Cardiac and Vascular Institute, we're celebrating our 30th anniversary. 30 years of pioneering minimally invasive techniques. 30 years of hard work and dedication by our top-tier leadership and world-renowned physicians and clinical staff. Creating a world-class comprehensive heart and vascular care center unlike any other. Committed to our guiding principles of outstanding quality care, continuous innovation, and a drive to save lives. 3 decades of excellence are the foundation for our exciting new expansion. A state-of-the-art facility, a first-in-the-world environment, with the latest technology. Recognized as one of America's best hospitals. We're proud of our history and committed to providing the best care today and in the future. We are innovators. We are leaders. We are Miami Cardiac and Vascular Institute at Baptist Health, South Florida.
Welcome back to the Health Channel. Of course, all health, all the time. I'm Ed Berliner. Thanks for joining us again. With us, Dr. Mario Zambrano, a pediatric emergency medicine physician at Homestead Hospital. If you have a question for Dr. Zambrano, you can call in using the toll-free number 855-796-4475, 855-796-4475. Today we're talking about vaccines for kids and teens. Now, we do have a list of recommended vaccines for children. I guess the biggest thing as we look at this list, doctor, is are they all necessary?
Yes, Ed, you know, unfortunately, there are certain diseases that are a little more serious than others, but in my eyes, you know, all the vaccines are important. You know, some physicians will tailor the vaccines to the liking of the parent, you know, or give them one at a time. I'm okay with that as long as they let me vaccinate. You know, it's better to give a few vaccines than no vaccines at all. But there's an increasing number of parents that don't want their child to suffer with multiple vaccines. We now have combination vaccines that makes it easier for the physician to give less vaccines.
Now,
but we give at least 3 at a time.
One of the recommendations is the HPV vaccine created around 2006.
Correct.
What does HPV stand for, and how do doctors know it works?
It's called human papilloma virus. You know, this virus is well known to trigger cancer, cervical cancer in females, penile cancer in males, and it causes warts as well. And there's a few also articles linking HPV to lung and throat cancer. It's one of the few vaccines that helps prevent cancer. So there is 2 types of vaccinations you can use. If you're under 14, you usually get 2. If you're over 14 years, you get 3 vaccines. But it's a safe vaccine. It does cause a little bit of local pain, which is you can take care of with a little bit of Tylenol.
But again, what we are looking at is those who say, my kid doesn't need it or they don't want it, because even though the HPV vaccine is highly recommended, as of last year, the CDC reports only 6 out of 10 parents chose to vaccinate, and the doctors are speaking out.
All right, we're in the package.
To tell a patient that they have cancer, particularly a cancer that could have been entirely prevented, is terribly depressing. I've shared tears, we've cried, and it's something that's not easy to do. This March, we had a 23-year-old who had an abnormal pap smear that suggested cancer. Well, unfortunately, when she came in and we tried to find her cervix, we couldn't. Everything on the inside was cancer. By October, she was dead, and she left a 5-year-old child alone to be raised. So it's devastating not only for the risk of potential death, but the morbidity associated with biopsies, with surgical procedures, and the real threat of potential inability to have children thereafter.
I always tell my parents I give the vaccine to both of my daughters. One is 14 now, one is 21, and I really do not want them to come to me 20 years from now and say, Mom, I have cervical cancer, and you did nothing to protect me. Studies have found that the provider recommendation is usually the strongest motivator to getting a parent to get their child vaccinated. And it's so easy to just say with conviction and say to them, this is a safe vaccine, this is an effective vaccine, I give it to my kids. I feel that it's important for you to protect your children at this young age with this vaccine. There's no reason for us to wait and miss an opportunity to vaccinate. As a pediatrician, I want to go to bed at night comfortable knowing that I'm helping to prevent cervical cancer or anal cancer later on in the lives of my patients. I don't want to see them ending up in an oncologist's office 20 years from now when I could have done something to prevent it. This is something that we can prevent. This is a vaccine that is safe, is effective, and it can prevent cancer. We need to use it.
And what we are dealing with here are vaccines that, if you were to put them up against biopsies, surgical procedures, other life-saving issues that you have to do later, are pennies compared to what you're going to spend later in life, yes?
That's correct. You know, these vaccines are, by the conspiracy theorists, are deemed money makers. I also wanted to discuss the fact that physicians nor insurance companies make money on vaccines. This is a service. The government gives vaccines to physicians for patients that have no insurance.
You don't make money on these.
We don't.
Even though people continue to think for some reason that you do, and that's why you want to vaccinate.
Right.
I want to go back to that list of recommended immunizations again, because I realize that you have said that all of these are necessary, that you would.
That's correct.
Would you give us an idea if, for whatever reason, you're not able to get all of these? If you're just to start at the bare minimum here, are there those that you say, look, these are the ones that absolutely, positively do not miss in your children?
Correct. The hepatitis B, this is a vaccine that prevents this virus from harboring in your liver and can trigger cancer. Also, meningitis vaccine. If you have meningitis at an early age, it can leave you with devastating problems, hearing problems, developmental delay. So that's a vaccine that I would give my child if I couldn't give any other vaccine. Polio, even though we don't see it often here, but people come from abroad and they're unvaccinated. Polio as a virus can leave you disabled. Hepatitis A vaccine is not as important because it makes you sick, but it doesn't give you cancer like hepatitis B. But it's an important vaccine to give. Tetanus, diphtheria, pertussis. Pertussis is making a comeback. Adults get it from other unvaccinated adults and children. So, and then vice versa, children get it from adults. So it's important to booster that vaccine as you get older.
Okay, correct me if I'm wrong what I just heard, but it sounds to me as if you're saying that pertussis is on the rise again because we've gone back to that cycle where children were not vaccinated, right. They made others sick. It has then gotten to the children and to the adults, so we are back to herd immunity again, yes?
That is correct. Pertussis, unfortunately, is making a resurgence, and it is preventable. Adults used to get just the TD vaccine, but now they have taken that off the market, and we have the Tdap, which has, aside from the tetanus and diphtheria, the pertussis or whooping cough vaccine.
Pertussis is the whooping cough
That's
vaccine.
Correct.
Okay, I wanted to make sure that everybody is unaware. You also said two words in there. You mentioned the words developmental delay.
Correct.
Something we have not talked about. Mm-hmm. If your child is not properly immunized, you can be putting your child at risk of their mental health, developmental, and physical delay. Would you explain that, please?
That's correct. So polio is a virus that affects your nerve system, and it can leave you with muscle atrophy and weakness, and you may not be able to walk. You may be wheelchair-bound if you get that virus. Meningitis can cause damage to your nerve system, and you can end up having developmental delay and cerebral palsy even, aside from maybe losing limbs. So yeah, there are certain agents that can give you encephalitis, like varicella can give you meningitis, encephalitis. Mumps can leave you sterile. If you get it when you're at a young age. Measles can give you encephalitis as well.
I want to go back to something we saw in one of the packages earlier, and I believe this was in Minnesota, and I think it's a point that needs to be made. What happened there was a Somali community.
Correct.
That very much did not go for the vaccines, but they really did not understand because their culture is different. Yeah. How much of what we're seeing today with regard to failing to get the vaccines for children is based on culture more than rumor?
I'd say a good percentage of it. In some cultures, crossbreeding is very common, and I think that has a lot to factor. We have to factor that in when we talk about autism. We don't know all the facts about autism, but we know for sure that vaccines are not the cause.
How do we then get through to these groups? Certainly they're coming here, they're immigrating, they're coming to America for a better life. But how do you as doctors get through to make them understand what they may believe from another country, from another societal time, from 30 years ago is no longer the fact?
Well, it's a difficult topic, but doing shows like this and bringing the diseases to light are very important. And also debunking the studies that have been done, blaming the vaccines for measles, for the autism, I think is very important.
And keep a reminder again that what you said is true. There is no connection between the cause of autism and vaccines, And many times what happens is the autism may be there, but it's not from the vaccines.
That's correct. We still don't have all the facts, as I said before, but we do know that at certain age we start seeing changes in a child that reverses their development. And unfortunately, MMR is one vaccine that is given at the time where all these changes are happening. And then since society has to find a culprit or a scapegoat, MMR right now is the culprit.
I think that's it. You just hit the word, scapegoat. That's what happens. All right, coming up, what you need to know. Plus, shots are no fun, but doctors continue to make getting a vaccine a better experience, an easier experience. We'll talk more about how the process of getting a vaccination continues to change and improve for you and your family. You are watching the Health Channel, All Health All the Time on South Florida PBS. If you have a question for Dr. Zambrano, 855-796-4475. Toll free, give us a call. Visit the website allhealthtv.com. Stay with us. Much more to come right here on the Health Channel.
In Saudi Arabia, a genome research program is leading to major advances in precision medicine.
The Saudi Human Genome Program was facilitated by advances in technology, which provided us with the basis to rapidly sequence the genomes of individuals to understand the basis of disease, and this became easily related to the health and welfare of patients.
It's already helping doctors to more precisely diagnose and treat diseases like cancer, Alzheimer's, and diabetes. For more, go to thermofisher.com/precision medicine.
1945 to 1965. People born during these years are 5 times more likely to have hepatitis C, a leading cause of liver cancer. And people can live with hepatitis C for decades without any symptoms. The good news? Now, treatments are available that can cure hepatitis C. So if you were born from 1945 to 1965, talk to your doctor about getting a blood test for hepatitis C. It's the only way to know.
Many websites selling medication may look professional and legitimate, but the vast majority of sites selling prescription drugs are doing so illegally. Criminals use websites to sell counterfeit medications that may contain life-threatening toxins. Dot Pharmacy is a website verification program that helps you identify safe and trustworthy online pharmacies. Purchasing medicine online can be safe and easy. Just look for pharmacy to the right of the dot in website addresses.
Having a hard time figuring out where to go for your healthcare needs? Baptist Health South Florida has just the tool for you. Simply log on to baptisthealth.net/careconvenience and choose your symptom. Within seconds, you'll be given several options you can choose from to get the right care at the right time. From locations and directions to scheduling an appointment, you'll have choices right at your fingertips. Now that's Carevenience, the cure for inconvenient care.
Welcome back again to the Health Channel, All Health All the Time. I'm Ed Berliner. Thanks for being here. With us again, Dr. Mario Zambrano. Dr. Zambrano is a pediatric emergency medicine physician at Homestead Hospital. I want to remind you again that if you do have a question for Dr. Zambrano, this is your last chance to get in here, 855-796-4475, 855-796-4475. Use the time wisely and get an answer you've been trying to get. Now, we've been talking about vaccinations and patients. I guess that we've talked about, look, we've talked about the vaccinations you've got to get for your kids. We've seen them. We've talked about them here. But when do you get them? And I guess where do you get them? Got to be from your physician, but when do you decide the right time?
Correct. As soon as the baby's born, you know, they're bombarded by agents from the day you were born. So the sooner you vaccinate, and the first vaccine that children get is the hepatitis B vaccine. It's usually given before they leave the hospital. Nonetheless, you know, some parents choose not to give it in the hospital for whatever reason. They can always get it at their doctor's office. And then the first couple of years, they get the brunt of their vaccines. You know, unfortunately, that's the time of where they get a lot of shots, and sometimes they have pain and all that. But I think it's short-lived, and if parents trust their physician, there won't be a problem with those vaccines.
If your kid cries from a shot, guess what? It's minor. It's going to last for 30 seconds.
Right.
And then the child's going to be feeling a whole lot better.
They won't remember the pain.
Do you see people, though, in your practice when the baby gets inoculated for one of those first times where they're screaming and they go into full freak?
Yes, they get very upset.
Don't get upset. It's a part of life. It's okay. It happens. It really does. All right. Let's go ahead and take a look at what parents might find on the CDC website, because we have said many times before, we're not going to go through all of these here, but quite frankly, you've got a tremendous amount of information in order to get. The CDC does a pretty good job. People, of course, you hear the conspiracy theorists will claim government intervention, but they do a pretty good job in keeping up and letting people know what's happening.
Definitely.
Yes?
Yes. Even though you see a busy schedule here, these are just recommended schedules where the vaccines are given to maximize the effectiveness of the vaccines. But the truth is, some of these vaccines, even if you get fully vaccinated, have to be boosted. Normally, what we do before they go off to college, we got to check their titers, because sometimes they don't have good titers for hepatitis B or measles or varicella.
We saw that there was a time when the flu virus, for instance, they get it wrong the last 2 years. Doctors are admitting that right now.
Yes.
With regard to these vaccines that we are talking about giving a child, these are standard, well-established vaccines. It's not as if they have to change the formula. How am I doing so far?
That's correct. Yeah, these are viruses and agents and bacteria that are stable. Their antigens don't change, but the flu vaccine mutates. So that's why it's a virus that's very tricky, and so far we don't have a good method of making it long-lasting, but we're getting there.
And these that we're vaccinating for here do not have a history of mutating.
That's correct.
Okay, to make the difference. I think that's important. Now, the number of recommended shots has increased over the years, obviously. So is there such a thing as too many shots? Let's listen then to a doctor from the CDC answer that question.
You know, I feel like, especially maybe it's because I have 3 kids, but I feel like I'm always going to the doctor to get shots. And so sometimes I just worry that we're getting too many shots. Is that really a concern? Is that a problem?
You know, it's an important question because now we have probably about twice as many vaccines to protect children as we did, say, 20 years ago. So even though children do get vaccines against about 14 different diseases now when they're quite young, that's not more than the body can handle. A child puts a toy in their mouth or crawls on the floor, and their immune system sees those germs, recognizes them, and teaches the body how to protect itself against them. Vaccines work in that way, and they help children's bodies recognize germs that can cause very serious diseases.
Do we need to have more sit-down conversations like that with mothers and fathers? I mean, in your practice, for instance, do you sit them down, talk to them? Do they ask? Do they want to know more?
Yes, nowadays they do. They ask you, and they want to read something that you give them. We give them something called a VIS, which has a summary of the vaccines that they're getting and the side effects and what they're being used for. And I think that's pretty useful for parents that are first parents, especially, that they're not comfortable with what you're giving them, or they have very little knowledge. You know, a lot of these people are not in the health field, so for them it's daunting.
As far as that overall schedule here, is there also a schedule on it or a point on that schedule where it says, yes, you can stop or you should stop getting vaccinations at this point?
Yes, there is. You know, once you reach 5 or 6, you should be fully vaccinated, and you know you shouldn't need any more vaccines until you go to 7th grade or you get to age 11. Then after 11, you get a few more, like the HPV, the meningitis vaccine. Now we have meningitis B vaccine, which, if you recall, it's a bacteria that causes fulminant meningitis. It's not as frequent as the regular meningitis, the MCV4. Meningitis B, we just developed it recently, but it's a safe vaccine. It was developed in Europe, and they brought it here for an epidemic that we have in one of the colleges, and it's also reduced the incidence of meningitis B, which is the one that can kill you in 24 hours.
If your child is 3 years old, you missed vaccinations for whatever. Now your child's 5. Can you catch up?
Yes, we can. We can give a scheduled, we call it a alternate schedule, to catch up these vaccines and make sure that they get what they need.
I want to go back to parents again, because to me it's one of the interesting factors in all this. And when it comes to being in your office, what do you do to make this fun, at least for them? I mean, I know it's kind of it's a little bit of an insane question, because nothing is fun for a parent about seeing their child get a needle stuck in them. But what can you do to help alleviate that?
Well, there's many techniques that each one develops through the years. You know, I saw a doctor the other day that sang to their child before giving the vaccine.
How's your voice? Can you sing?
No, I'm not a very good singer. But he would play with the shot, and then all of a sudden he gave the shot. And the child didn't even flinch. I use something called a shot blocker, and that helps a lot decrease the pain.
I've often thought if you play Springsteen in the office.
It's a good choice. Good choice, Ed.
Play Bruce Springsteen and everybody's happy. That way the child calms down. See, now at least you know. You all know what to send me now as far as for Christmas and holiday time. I got about 2 minutes left here. What's new? What's coming? And what are we looking forward to in vaccinations that will help us as we move down the road and the world around us changes?
Well, science is advancing in the sense that they're finding newer ways to administer vaccines. They're developing patches, they're developing needleless inoculations, which I think is exciting for parents that have needle phobia.
How would that work? Needleless injection?
Yes.
Needleless, how would that work?
They use it, they inject the agent through air, through the pores. And it does the same job as the injection, but it's an expensive technology at this point. Not everyone can afford it.
Almost like a spray?
Correct, it's a spray. It's a spray that injects with pressure into the pores, and you get the same effect as an inoculation with an injection.
So with about a minute left, how confident are you that the science will continue to move forward and we will continue to be able to convince people that they must vaccinate their children?
I'm very confident, and thanks to shows like yours, Ed, where brings these topics to light and we talk about it. You know, unfortunately, doctors are not very good at doing this, and we're getting better, you know, with the advent of the internet and social media. But we still have a lot to learn. But I think in the future we'll be in a better position to convince parents and society in general that vaccines are important.
You need to continue to speak out. You need to continue when there are the Jenny McCarthys of the world and some of the others. You need to be right there to tell them, you are wrong. Here is the science. We can prove it.
Right.
And I think that's where we're at. We're almost there.
We're almost there.
And I think people like you, doctors like you, need to be commended, because speaking out against this and being out there and being on the front lines is exactly what's needed to change a lot of these attitudes.
Well, thank you, Ed.
It's a pleasure, my friend.
Likewise.
It's great seeing you again. We will continue to do this. This is a passionate story that I've been involved in for many years, and I have covered this story many times. And I cannot tell you the kind of arguments I've gotten into on the air sometime over this. But Dr. Zambrano and others say it very succinctly. Get the vaccinations for your child. It is the simplest, easiest, least expensive way to take care of your children and take care of those around you. That's all we've got for today. Whew. This was worth every second. Join us next time on the Health Channel. All Health All the Time on South Florida PBS, and visit the website, allhealthtv.com. I'm Ed Berliner. Thanks so much for joining us. We'll see you next time.